So North Country Family Health Center is a federally qualified health center. We started in 1971, really a great story of a group of dedicated individuals getting together to meet a need in the community, being children that were not getting preventative health care services. So the agency, over time, meeting those needs was often looking for grants to kind of make ends meet and relying on donations and legislative number items to make the budget work every year. And in 2011 applied for a new access point to become a federally qualified health center. We looked to an FQHC grant to provide relief to the agency that was always struggling financially, and the transition to an FQHC was definitely a hard one for the agency and brought the health center to a crisis point.
We were in pretty bad shape. The day I came in the door and asked to look at financials to see what our cash position was, I was shocked to see that literally there was no cash. We had no money, and we didn't know when we were going to get any. The safety nets had all dried up. Our banking partner had said, we're not going to be able to fund anymore until you make some serious changes. And we had a hard time managing the transition to become a federally qualified health center from a billing perspective. We didn't have the capacity to handle the claims, the number of claims, and we didn't have the expertise. During this financial crisis, the board voted to temporarily suspend operations. Well, the New York State Department of Health said, no, you're not going to do that. You can't do that. Where are these patients going to go? Who's going to serve these patients? Not to mention your staff, but the impact to the community is too great. That's not going to happen. We're not going to let you do that.
At the crisis point, the agency looked to its community partners as well as to partners that we had worked with for various projects. And we had worked with Visualutions on our Vis Dental component of our electronic health record, and at the time was looking at 2 huge billing projects, and those billing projects were something that we knew we did not have the core competencies to do in-house. So we had reached out to Visualutions to look into doing those billing projects for us, and is also looking into whether they could take our RCM services in-house.
Their 2-pronged approach to stabilize and optimize our workflow, as well as address our back AR, our old AR. We had some major rebilling projects that needed to be done, was really the main reason we chose to go with Visualutions for our revenue cycle management.
Visualutions was the only company that was willing to not only tackle our 2 billing projects, but tackle our whole RCM services so that we could outsource those. And working with Visualutions as our partner allowed us to have the expertise through an outside company, as we knew that wasn't a core competency of ours.
We were thrilled with what Visualutions could do for us. They came in right away, stabilized our workflow, and got claims out the door and cash in the door. They tackled our rebilling projects immediately. I do remember the first day that we were expecting a large influx of cash from one of the rebilling projects, and New York State Medicaid has a call-in line. You call in Thursday mornings to see what your payment is going to be for the next week. I couldn't sleep the night before. I was so excited. I just couldn't shut my mind off. So at 4 o'clock in the morning, I got up and I called the Medicaid line to see what the payment was, and I'll never forget that day and what the amount was. It was January 23rd of 2014, and we heard that we were going to get $224,222.19 in that next week, and we were just thrilled.
We were able to go from having, in essence, no cash, so an agency that was going to shut the doors because they had no cash on hand, to having over 120 days cash on hand now. Significantly improved accounts receivable. Our accounts receivable is typically in the 20-day mark, and we have focused heavily on looking at how we can invest in the agency, and part of that investment is how we can improve IT infrastructure and IT equipment so that our staff have the resources that they need to continue to provide high quality patient care.
In choosing Visualutions, we hit a home run on this one. We knocked it out of the park, actually, and we would not have been able to stabilize our operations without Visualutions leading that way from a revenue cycle management perspective.